and welcome
Hello.
to Meds. This week we are finally, after many weeks, taking a break from coronavirus talk and talking a little bit along the lines of coronavirus because a lot of people are at home and sedentary and gaining weight. So we are super excited to announce that we have a special guest today. We have Dr. Kathleen Slugocki with us. She is our medical director for Women's Healthcare of Illinois. She is not David's medical director, but she is our...
I still defer to her for a lot of questions.
She is our mama bear. She has all the knowledge of all the things. And today, we're really proud of her and excited to announce that she is officially obesity board certified.
Yes. So I finally, after 2 years of study, passed my obesity boards. I was a little nervous because I had to learn about pediatrics and men. I don't really, taking care of men is a whole new world for me again.
We're in the OBGYN world.
Yes, I deliver babies. But now I'm certified to take care of men, women, and children to help them with their weight issues.
Excellent.
Awesome. So David, do you have some questions for Dr. Slugocki today?
Yes, so Dr. Slugocki, there are over 300,000 Americans that die every year from obesity-related issues. So it's a huge issue. What are the benefits of talking about obesity as a disease and not as what probably a lot of patients have heard about, eat better and lose weight?
I think it's super important because I think there's this problem with our medical care that patients and people you go to their doctors and they would rather be put on a medication for their high blood pressure, their diabetes, and that there's this overwhelming bias against patients who struggle with their weight that it's their fault. So it's your fault that you're overweight, so you don't deserve a tool like bariatric surgery or medications that actually help you lose weight. As I told a patient today, I would rather see her significant other who's going to make an appointment with me on a medication for his obesity versus a hypertension medication, a diabetic medication. Even if we're on these medications lifelong, you're still going to be healthier on those than you are still overweight on a medication for your diabetes.
Right, that's a good point. That's really interesting.
We talked about how some patients might feel a little bit nervous about bringing up issues with weight at their appointment. What has been your experience? What have been the most significant barriers or obstacles to patients actually trying to do something about their weight and talking to their physicians?
Well, I think there's a lot of shame. As somebody who struggled with my weight my entire life, since I was 5 years old, I personally had bariatric surgery. I fight this all the time. And you feel shame. You feel like there's something wrong with you. And it took me for a long time, even as a physician, I thought of surgery as an easier way out, that I didn't need that because if I just worked out, I actually just handled together. But at one point I looked at myself, okay, I'm a pretty driven person. Whatever I want, I accomplish. Why can't I lose weight? And I think it was finally acknowledging and realizing obesity is a disease. My metabolism, my body, my hunger hormones are completely different than somebody who's been lean their entire life. So I think it's just what for me was acknowledging that. But I think that sometimes our healthcare system is really flawed because there is a bias against patients who do struggle with obesity. So it's just a matter of making them feel comfortable that this Women's Healthcare of Illinois, family first, we're a safe place for patients to come to who struggle with their weight. We're not going to judge, we're going to help you. And I think that as more and more physicians take on learning about obesity as a disease, the more patients are going to feel more comfortable. And it's just working together on this. You walk into an office and, well, the chairs, do you fit in the chair? Do you look around for the chair that doesn't have the arms? Those things are more of a friendly environment. A patient comes in with a cough and some doctors take the time to shame them about their weight. And that's a big one. That's a big one that patients complain about so I always approach my patients. Is it okay if we talk about your weight today? That's kind of just about how we talk to our patients. And one of my other things that I'm very passionate about is working with other physicians to bring awareness against this bias. I recently spoke at a conference about surgical issues with obesity, but one of my biggest things in my message was that this is a disease. We make sure that physicians recognize we have to change it within our own community so patients are more comfortable.
Okay. Dr. Slugocki, how do you decide which patients are good candidates for medication for weight loss?
So there is some basic standardization of who qualifies based on BMI. So BMI is where we look at a ratio of a patient's weight to their height, and then it's categorized. So over 25 is a patient who would be considered in the overweight category, and anything over 30 falls into the category of a patient having obesity. Okay, so, but I individualize it. So it just depends. The patient could walk in and their number could be a BMI of 40, but they're not quite ready to start medication. That we start on working on our goals and making sure that we're in the right direction. But I could have somebody who has an BMI of 27 that's been struggling forever, that it really is worth the conversation to see if maybe they would be the right person to start medication.
Great. And we were talking about some of these medications are quite effective now.
They are, phentermine has been on the market for decades, and we're seeing that we can maybe use it as more of a chronic medication. I think there's also a fear of some of the medications. I mean, you two maybe weren't really around. I was maybe a teenager for the fen craze. I'm a little bit older than these two. But there was some significant side effects of valvular heart disease, and phentermine was the safe portion of that combination. So we use that with other combinations. It's kind of repurposing a lot of medications, and the most recent repurposing was the diabetic medications. And those are the medications that I feel is the future of weight loss medication. And by giving some of these medications, it actually mimics some of the wonderful benefits of bariatric surgery, because it's a metabolic surgery. It changes your hormone structure. So I think it's really important to recognize that these medications can be really helpful.
So this is a prescribed medication. It's not like going to your local drugstore and picking up some weight loss medication.
Yeah, please don't do that.
No hydroxycut?
No hydroxycut.
No.
Trust me, some of the physicians in those pictures were always really lean and they gained the weight for those ads.
Oh, wow.
I know one of them.
Wow.
Mm-hmm. So a lot of patients obviously struggle with their weight, but how do patients know that they are the right candidate for this? How do they know that they haven't tried the right diet, they aren't doing enough? How do they know that they qualify to meet with you or to be on a medication? What should be their next step to meet with you?
I think so. First of all, and you can always make an appointment. So you can call our phone number, which I know is listed, and we can have an evaluation. I think it really comes to a number. I think anybody whose BMI, if your weight is over, or BMI over 25, I think it's important to come in and have those conversations. And one of the things that I try to be very sensitive to, that even for somebody who's gained 15 pounds and is technically now disqualifies as overweight, for me, I want to be as sensitive to them as my patient that's struggling with their weight like I am. Because what happens is if we gain that 10 to 15, and then we let a few years go by, it could be 30. And it slowly happens. And I see it happen with my patients all the time. Between the ages of 40 and 50, you can easily gain 4 pounds a year if you change nothing, right? So those perimenopausal patients, that is when it's so important to really get a handle on it and start changing things around.
I think you've done a really good job highlighting how this is a comprehensive approach, but something tells me that this isn't the end, that there are things in the future that you're hoping to offer for our patients. Can you tell us a little bit about that?
Yes, because unfortunately, one visit meeting with me once a month most likely isn't going to be enough. Even with the perfect tool medication and the perfect patient, this is a lifelong struggle. There are studies that show that you need 16 visits in a 12-week time to have the proper emotional, behavioral coaching and motivational interviewing. So I'm really hoping that in the near future that we have some sort of a set program that, yes, you have your medical visits with me, but maybe I can be also offering some sort of counseling and support. I also do dream about more of a multidisciplinary approach where we bring in other people to work with us. I really feel that there, being a gynecologist, one area that I uniquely can really support are our patients that struggle with polycystic ovarian syndrome. Because as a gynecologist, I can help them with their fertility issues, I can help them with their cycles, but I can also help them lose the weight that will actually cure and reverse their disease. However, there's so many emotional struggles. I feel like they need almost a therapy approach sometimes because of the lifelong battle with it. So just kind of some ideas that I have that as we move forward through our surviving COVID, we can have the practice start kind of supporting
the future without COVID.
Yes, it will happen.
If you can believe it.
But get the vaccine when it's offered.
All right, well, it's been great, you guys. Hopefully everyone's hanging in there, and the stay at home will be lifted sooner than later.
Go outside.
Remember,
Socially distance.
still socially distanced.
Go outside though.
Okay to still wear a mask at the store.
Please wear a mask.
Still
at the
not
store.
okay to wear gloves everywhere you go.
No, don't wear the gloves.
I had a patient take off her gloves during a visit today after I talked to her about it. I felt accomplished.
Winning. Winning. Go ahead.
So Dr. Slugocki, you are an OB-GYN, but are you able to see men who struggle with weight loss? You know, at Family First Medical Group, we see everyone. We see kids, men, women. Can we have some of our patients come and see you?
Of course, as long as the men keep their shirts on during the telehealth visit.
Men, wear your shirts during telehealth. So even though it'll be really weird for Dr. Slugocki to take care of a man, she is open to it.
I am, and all
okay.
kidding aside, because of the whole COVID situation, I've gotten used to seeing male patients, and I did in med school, and that was actually part of the boards. The boards that I took were men, women, children. And I think it's really important, you know, one of the things I set up for a future visit for a patient was, I'm like, you know what, let's do your next visit telehealth, and let's have your fiance schedule too, so I can help you both as a unit, because I think it's super important to tackle the whole household, especially with children.
Sure.
Children, we have to really look at the family as a unit. And a lot of times if children are struggling, their parents are struggling. Sometimes they're not, but usually there's some history there because if a couple both suffer from obesity, their children have an 80% chance of struggling.
Wow.
So
So if a patient comes to see I or Dr. Beckman and has some issues or concerns with obesity and maybe wants to discuss being on some form of medication, they can surely make an appointment with you.
exactly,
And the appointment would be for what? I've often had people say.
for a weight loss consult.
Weight loss consult.
Great.
You heard it here yourself.
Excellent. Wait, no, it's
It's stopped.
recording. Now it's recording.
Now it's recording?
Uh-oh. That whole thing not record.
Oh no, that's
It's
pretty good.
Yeah.
That works.